Texas prisons have tested more inmates in the last 3 days for COVID-19 than they've done in the last 2 months. The Texas Department of Criminal Justice reports an additional 16,000 inmates and staff members have now been tested, all thanks to new swab kits. We're still waiting on the results to see if people who are not showing symptoms have the virus and are causing it to spread. KXAN investigator Erin Cargile has been digging into how the coronavirus outbreak and response in Texas prisons compares to other states.
I'm grateful. I'm grateful that they're going to test. That was one of the demands on our list of things that we want to change.
Lavina Igbani is pleased to hear about new widespread coronavirus testing happening in prisons across the state, including the Eastham unit north of Huntsville, where she says her husband is serving time.
It's personal to me. It's personal to me when every day when I check the website and I see it's 50, last time I checked yesterday was like 51 positive cases at his unit.
As of Wednesday, the Texas Department of Criminal Justice had tested less than 2% of the 140,000 Texas prisoners. Friday, that number jumped to more than 12%, thanks to these new coronavirus swab tests purchased by the state that inmates and staff can do themselves. TDCJ says strike teams are starting at units with the highest number of COVID-19 cases and handing them out to people not showing symptoms.
Over the next couple of weeks, we'll be testing all of the offenders and employees at every unit that has a positive test, whether it's an offender test or an employee test.
Those who test positive will be placed in dorms together.
Now, the ability to take those asymptomatic but positive offenders and further cohort them and just get into groups where we know, this entire group is positives, that can be nothing but good as far as the overall attack on COVID-19.
For weeks, prison advocates and experts have been calling for mass testing in prisons to get a handle on what's really happening inside.
I think people are not going to be happy with what they find when they do this expansive testing. And it will put more pressure on the system to, to get the numbers down and to safely manage the people who are incarcerated and the people who work in these facilities.
Other states like Tennessee, Ohio, and Arkansas that were some of the first to start mass testing in prisons are seeing the number of cases spike and are finding most positive prisoners were asymptomatic. That's also the case in North Carolina, where Lauren Brinkley Rubenstein has spent more than 15 years studying the health of those incarcerated. She has her opinion about why states, including Texas, waited until they had outbreaks to take action.
I think it's political. If I'm being honest, if you don't test, you're not finding cases, and then maybe you're not as likely to get a lot of attention because it's a superficial way to make people think that maybe you don't have cases on the inside. I think the other reason is resources.
She believes prison systems are not to blame due to the limited resources they have to deal with the pandemic, and says public health entities should be thinking about prisons in the same context as the communities around them. Erin Cargile, KXAN, investigates.
The swab tests being used in Texas prisons are from a California company called Curative Incorporated. Texas paid them $45 million for 300,000 tests. The state's Office of Emergency Management tells us they are not all reserved for prisons. TDCJ believes it will need about 110,000 to cover the first wave of people. The rest of the tests are sitting in a warehouse and could be used in nursing homes and county jails if needed.